If I can just formally welcome everybody to the workshop. I do need to just check you all do know we are talking laundry. So if you think it's HR, make a quick exit. But anyway, we're delighted to be able to talk laundry for half an hour. And hopefully, and if it goes well, I'm only going to talk for sort of 2 or 3 minutes because we really want to make this a workshop. Because from the TSA, we don't understand that much about care homes. We know a lot about laundry. I wake up and think laundry every day, but we don't really do care home laundry. So part of this is to engage with you people around how we can come up to solutions, build back better, and just see what the market is. So it's sort of laundry in the care home setting is the title. If I can just introduce myself, I'm David Stevens. Oh, I have to stay near the mic. I'm CEO of the TSA, and I'll just touch on that in a moment. Katie, who's been on every keynote this morning and this afternoon, has been working really hard with us on the research side of the information we're going to present today and the survey we're going to talk about. And I think we've handed everybody a little postcard because we're really this about information gathering today. And then Shaiju does all the clever stuff within the TSA and is director of our projects and anything I can't do, which is most. So the TSA, and we'll sort of confess openly, we are the commercial laundry sector. So we represent about 95% of the commercial laundries in the UK. And actually, most laundry in the UK is outsourced, except in the care home sector. So part of this conversation is to understand a bit more about that. Why is the care home sector predominantly 95% in-house, on-premise laundry, whereas virtually every other sector is actually moved towards an outsourced solution. So this is about understanding a bit more about that and how we can facilitate the process and support your sector in laundry and understanding the needs of the laundry sector. So we've sort of been on a bit of a journey to get here today because naturally we would have talked healthcare, hospitality and industrial, and we've never really talked social or social care, the sector. It's just not been on our agenda. I think COVID slightly changed that, and we certainly during the COVID pandemic started to get more conversations from the care home sector around COVID. Does it really disinfect? Are there procedures we should put in place? And you weren't alone. We had hundreds of calls from UK hospitality and other sectors around COVID. And the advice at the beginning was to burn all the linen. If somebody slept in a room with COVID, burn the linen. Well, there'd be no linen left in the country if that had happened. So we developed the processes and the systems, working closely with NHSI and NHSE and the rest to come up with procedures. But Katie was fundamental in that in doing some COVID research. And we'd already started on that journey, and Katie's really going to get onto the clever bit in a minute. But what we did understand during this process was that maybe there was a knowledge gap within some of the care home sectors around laundry, outsourcing laundry, and certainly we look at the European model, it's virtually 90% outsourced. So why is the UK 90% in-house? Why is the European model 90% outsourced? So we were trying to understand some of the reasons for that and what support and how can we help the care home sector with some of the knowledge and the information you may need to make those decisions. Because if we look at the existing practices, care homes are meant to conform with the same regulations as a primary care hospital, which does seem a bit over the top, probably unrealistic. So what information do you need? What support can we give the care home sector? And you probably don't need to comply with HTM 104, which is a pretty tough standard. Maybe a very large care home with an on-premise laundry could, but for the smaller sectors, there must be a hybrid solution where you get much smaller information. We were talking earlier about maybe some YouTube videos around this is actually, if you cut through all those 200 pages, these are the 10 minutes you actually need to understand, and this is where infection control in laundry could be relevant. To help us guide us on that process, we've doing through DMU a information survey on the attitude and knowledge base within the care home sector around infection control within the laundry environment. And there's 2 areas within the questionnaire, but we'll pick that up at the end. But we're really, really keen to understand the information out there and what support the sector may need to move forward. So I'm going to sort of hand over to Katie to talk through where we come from and the journey we've been on with DMU and why we think actually it's a really, really good time to talk laundry. Over to you, Katie. And then we're going to try and open it up a bit, aren't we, I think?
Yeah. So I'm going to talk to you for a few minutes, but the idea of this session is, because we've all been sitting listening for most of the day, is actually to open up a discussion amongst the experts, which is you sitting in the room basically, because you're in those sites, you understand the laundry, and also the different types of laundry that you may have in your individual settings. Because from a hospitality or healthcare setting, there's quite standardised items that go through those industrial processes or in-house laundering. But within a care home, you've got the personalised items, you've got bedding, you've got uniforms, all sorts of things going on. So it's much more complex, and maybe a lack of understanding from both the industrial launderers, from in-house launderers, and from infection control prevention as well from inside individual care homes. So for those of you that were in the facilities management session this morning, some of this is a slight repeat, but I just want to give you a little bit of background on why this is so important and why textiles as a surface, as a fomite, so a surface that's able to transmit or carry microorganisms, is really important. So we're saying that we need to launder textiles at 60 degrees or above in order to remove microorganisms, and that's absolutely correct. However, sometimes garments are not able to be washed at 40 degrees and above, although they're in an environment where they're potentially picking up infectious bacteria or viruses. So it's really important. Our research has shown that yes, if you follow NHS guidelines at 60 degrees, you're able to kill the bacteria or remove the bacteria through all the agitation and dilution. But once you start to lower that temperature, bacteria is able to survive and also pass on to other items in the wash. So that's really important. But what else is important is that textiles themselves can transfer microorganisms onto other surfaces. And we showed this through the research that we were doing on coronavirus, through the pandemic, and we've shown this with bacteria as well. So it's really important that there is infection control procedures around laundering, and not just the laundry process itself, which you can standardise quite readily, but what about all of the things that happen from that patient wearing that garment to it getting into the washing machine? And that may be the most important bit in a care home environment. Who's handling it? Where's it stored? Is the dirty linen with the clean linen? Has it touched any other surfaces? Is this known to be infectious? Is this a C. difficile patient or someone with norovirus? Whatever it may be within that care home environment. So that bit is really important, and this is something that came out of the research that we did during the pandemic as well. 40-degree wash gets rid of coronavirus. What happens from the point that that textile is potentially contaminated to it goes in the machine? You've taken a car journey from a hospital, you've shared a linen basket with some other items of clothing, etc. And you've also got the healthcare workers' uniforms and what your policies are around that. Is it where they domestically launder them, or is it where you in-house launder them? So these are just things that need thinking about and some consideration. And as I mentioned, the C. difficile patients, obviously, there's a tendency towards this in care homes. You've got elderly patients on lots of antibiotics, and obviously that allows the proliferation of C. difficile, but spores are much harder to move from environmental sources, and we've shown that on textiles as well that have come from ward to washer. Some other research we've done with psychology colleagues involved, education colleagues involved, is looking at opinions and attitudes of nurses towards their laundering. And I suppose really these points here is just to show the expertise in this area and the fact that we need to listen to those people and create policies that work for the care homes. So it allows us to build back better, and rather than you being done to, here's a policy, you need to follow it and to get your accreditation, you have to tick these boxes. It needs to be more about how does it work in your home, where are the barriers, how do we fill those gaps in, and how can you inform the policies that you need to enable your infection control within the environments that you're in. And it will be varied. The social care sector is varied in its own, whether it's single site, multi-site. There's so many variations in there. And that's what this survey is about. It's about knowledge gathering, as David's said. It's about understanding what processes are in place, what knowledge is there, how we fill the gaps, what are the barriers, and how can the TSA facilitate plugging in those barriers for and enabling you to sort of be empowered to do that infection control procedures around laundry. So the project's only begun recently. We've had about 400 responses to the survey so far, and it has been split between healthcare workers and managers because the viewpoints on that are quite different. So what does a manager feel the barrier is? That could be financial, it could be environment in terms of space. And what do the healthcare workers feel the barriers are? Because is it that the policy isn't in place? Is the policy clear? Do you understand it? Do you have dedicated workers just for laundry, etc.? So the barriers or prevention for implementation of this may be very different points of view. And by understanding that, the TSA can tailor education programs, whatever it is, to the needs of the different departments as well as the different sites. And that's what we're trying to establish. So I think, yeah, do you want to? Yeah. So what we've actually done next, I'm looking for the clicker. David's got so much paper on here. Ah, right, okay, lovely. So what we're trying to do now, and we'd like to open this up for discussion because you've all been sitting for a long while, and actually what we're interested in, what you've got to say, is we've posed some questions. So we've got 2 questions, I believe, haven't we? And if we have time, I have one around sluice rooms, but we'll leave that for now. So we've got 2 survey questions, and we just want to start a bit of a discussion around it, if that's okay with everyone. That's why we asked everyone to move forward. So, is that the second question, David? Did you skip one?
There are 2.
Yeah, okay, let's start with this one then. So what we really want to ask is, how do you feel infected or fouled linen work, so your linen, is handled within your environments? And could you really see any improvements there? What are your opinions on this? Is it even on anybody's radar? So I don't know if anyone wants to, we want discussion, we want to turn it into a bit of a workshop, so I don't know if anyone wants to start us off on that. Yes, yeah. Oh, sorry, we'll come to you next, yeah.
You can hear me?
Yes, yeah, we can hear you.
Yeah, so in our workplace, I mean, firstly, we have all of our laundry separated and color-coded into different bags. So Infectious laundry is in red linen bags. You know, normally when you have Infectious laundry, the healthcare workers would need to go and collect the red linen bag bring it to the patient's bedroom. Then obviously deposit it in there once they put it in red washable dissolving bag, yes. And then once it gets, so essentially you have a few different collections throughout the day from the laundry team. They'll come over and collect all of this laundry. Normally they'll obviously collect it, bring it over to our main laundry department. Usually whenever they're doing an infected load, they would have to wear complete PPE as any care worker would, fully with a donning and doffing process, which everyone in our home has, infection control, competency, assessment done with them, like usually within a month of the onboarding process, so that just to try to make sure that every step of the way that people are trying to be as safe as possible.
Would you say you think it's quite a good process? You're comfortable with it at the moment?
I would say yes. I'd say one thing that can probably be improved, I suppose, is with collecting that laundry, is just making sure that the laundry workers are you know, collecting the infected laundry separately from everything else, which I'm not sure if they are doing perfectly every single time. But yeah, I'd say that's probably what we can improve on. We have our own satellite kitchens, as well, but then we have a main kitchen.
Do they use washing machines or anything like that?
So they use separate. So like we have a housekeeper for each unit. We're a 4-unit home at the moment. Normally 5 units, but one's closed for refurbishment. So the housekeepers will collect all of the hand towels, all of the cloths used for cleaning and everything like this, all of the mop heads and everything like that, and they'll store them separately, and then they'll also bring them separately to all of the laundry loads over to the main laundry department, and same thing, all of those will be washed separately compared to the clothes.
I would say that's quite impressive. If
Yeah,
you're
I
actually
would,
segregating to that level, that's good. Is that standard practice? I'm not asking people to shoot themselves in public, but
Yeah.
is that a question? Sorry.
There was a question about the.
I'm not a care home manager, but I was brought into post. I'm an IPC specialist, so I was brought into post to look after the care homes across Northamptonshire and support the care home managers during the COVID period. And with doing that, initially it was all COVID, we were supporting the care homes with COVID, but we've moved on from that now. And we're now using the Infection Prevention Society quality improvement tools. Part of them tools is looking at the laundry process. One of the things across Northamptonshire, what we're trying to assist the managers with, one, they haven't got appropriate facilities. They're doing the best they can with what they've got. And some of the washing machines are not the appropriate type of washing machines. They're just domestic washing machines, they're not industrial. So even though we're thinking we're putting them on the right temperature, they're not, we don't know that they are reaching the right temperature. So we've kind of picked up an awful lot in going into the care homes and supporting them with it. But there is a lot of work that needs to be done around the management of linen.
Katie, you might want to just come. We did do some work on that, didn't we?
Yeah, we've just recently finished some work on that. It's not published yet, but it was we've looked at a range of domestic washing machines and looked at the temperatures that they're reaching. We did it across 6, and I think actually 2 were reaching 60 degrees. However, that was enough to kill the bacteria. But what we also looked at was the eco and rapid washes, and one machine was only reaching, it was ambient, it wasn't even heating up in the time period, and it certainly wasn't killing the bacteria. So absolutely domestic machines. And there was some correlation between age and performance and holding temperature, which you would expect. However, that can't be managed. Sorry, go on, you can say something.
Can I just ask if there's been any work on the sluice cycle? Because obviously with a domestic washing machine, you put it on a sluice cycle, so I don't know about this. But I'm just thinking, some managers will put it on a sluice cycle with the best intentions that it's doing its job, going on a sluice cycle. They haven't got appropriate dump valves to chop and churn as it's being sucked down, so you will get feedback. So if they put something with bodily fluids in, you may get feedback back into the laundry.
We haven't looked at that, but it's on the radar now, so. Okay. So,
Any other sort of questions? Yep.
oh, yeah.
She's on her
Just
way
bringing
on
the
this.
mic over there, yeah.
Thanks. I'm Heather Gentry. I'm an infection prevention practitioner too. I think the biggest thing for me, having worked in both the acute sector, so looked at big sort of laundries as well as working with the care homes, is the lack of understanding that, sort of washed linen is as dirty as unwashed linen until you dry it. So there is, as part of the process, if you've washed something, whilst you're physically removing a lot of soil, what you won't have done is necessarily killed all of the bacteria in the load. And I think it's people understanding that when they're handling linen from the pre-wash through the wash and then taking it out to put it perhaps in a dryer if it's not an integral dryer, is that people still need to understand that there is potential for contamination.
I think infection control is from the bedroom all the way through back to the bedroom. So certainly within a laundry environment, you've got lots of opportunities for cross-contamination. I think generally washing machines will provide a critical control point of disinfection if you have temperature or chemical disinfection.
Absolutely,
And
yeah.
part of the research, again, we've done with the MU, is it may not just be temperature, because if we look at personal clothing, you can't boil wash.
An alternative to heat. absolutely.
wool, and even the tumbler probably, generally the washing machine is a better point of critical infection control than a tumbler because it's airborne. It's harder to prove the temperature disinfection in a tumbler, but it's almost all the way through the process. You can unload a tumbler into a dirty soil trolley,
Absolutely.
and you've just damaged all the work
It's
from the
total drying,
wash.
isn't it? So you've got to make sure that you haven't got, it's not damp.
And even PPE, you should be changing your PPE between loading the washing machine and unloading it.
And it's not loading you to soil.
Unless you've got barrier washers, but I'm going to guess you're front loading. So that's not a technical, you load in and out. Whereas ideally you want a barrier, so you load in one side and out the other side, so you have a clean area and a soiled area. But sorry.
I think, just picking up on that point before we move to that lady, I think what's really important there is you're talking the difference between kill and removal.
Absolutely.
And, well, the TSA have funded a large piece of work on that, which hopefully should be in the, which should be in the public domain relatively soon, that will allow for testing of whatever processor you're using, whether it's temperature, whether it's chemical, whether it's whatever fairy dust, that will prove that there is a kill, and at that point, then yes, it's okay to use this process.
The point around the types of machines in use, because particularly if you've got a small supported living or learning difficulty setting, you know, to actually purchase a sort of a proper system where you can monitor temperature, etc. And it's, I can't think of the word, but you know what I mean.
Yeah.
But basically, I think
The validation of the process.
yeah, and I think that's an issue.
They normally start off well and then fade.
But hopefully this test will allow you to carry out the test. Yeah, you might have to send it for microbiological testing once a year or twice a year in a care home setting, whatever it is they decide. But you'll be able to validate your process without having necessarily a really expensive piece of kit.
And at the moment, generally, it's thermal. Most people are comfortable with thermal disinfection. And I'm going to guess most people will be using temperature as the disinfection point, generally. As we move to a more sustainable temperature might actually come back into the equation. If it's a green source, then the temperature might be good. But generally, we're looking to try and lower temperatures within washing areas just because of the cost of the energy. But you do need to know you've got a kill. So this test would measure kill, not temperature. It would measure just, are the bugs dead? I use a tea bag. You put the bugs in a tea bag, they can't get out. So you then test the tea bag, and if they're dead, they're dead.
Yeah, it's a bioindicator.
Yeah.
I think this lady...
Just out of real interest, does anybody in the room outsource their laundry currently, or is it all by in-house, as in on-premise laundry? So everybody would have in-house laundry at the moment?
Okay, it's interesting. I think this lady here's got a question. Sorry.
The mic's on its way. Interesting.
Hi, I'm Sandra. I'm from HC1. And I actually do training in housekeeping and catering. And part of our training is whenever the housekeepers collect laundry, they have to have PPE on. The trolley has to be disinfected before they go and collect the dirty laundry. And all the laundry bags are colour-coded. And the bag goes into the laundry with the dirty laundry. And they do not sort any of the laundry in the laundry room. And they've got clear demarcation of where the clean and dirty is, and they also have separate, they have a red container for dirty and then a white container for clean. So as soon as the washing's done, you go straight in the white container and it goes, and it's all on wheels so they don't have to do any manual handling, and it goes straight to the dryers and they dry, and then in the white tubs to do the folding and packing away.
For personal care, so as in personal clothing, is that a more challenging area?
Obviously, if the resident's laundry is soiled, it would go into the red bag. But we also have a green bag for their delicate laundry. So if we have like a cashmere sweater or a silk stuff, it goes into a different colour-coded bag so that the laundry staff know that it has to go on a delicate wash.
I mean, that's impressive. I would say that's good.
There's some really good practice going on, which is good to hear. So.
And all of our laundry is covered as well. It's not exposed. So everything's covered, towels covered, they return in a covered trolley.
I mean, I think we'll find massive inconsistency out there. I mean, we got a phone call, I'm looking at charging it, last week from a health authority about what is the policy on outdoor line drying. And we were sort of laughing about it, but actually if you're a small care home, yeah, there probably is outdoor line drying going on, and it's not covered anywhere.
No.
And we were like, whoa, who would line dry? Now, when you think about it, if you're a 10-bed, 12-bed care home, it's actually probably quite good. I mean, environmentally, it's fantastic. But what's the policy on that? I think I know. But...
Obviously, when you use a heat source, you're going to reduce the bacteria. We did do a piece of work on steam ironers during the pandemic for a company, and they were very good at reducing the virus at the point where the steam is hitting it, but as it spreads out, it reduces temperature quite quickly. So you've got consistency over the garment there. But we were... that comment that come out, it was really, there was some papers published on an organism called Enterococcus, which is quite thermotolerant, so it withstands heat quite a lot. And they did show an additional 4 log reduction within a tumble dryer. But obviously with cost of living going up and energy and everything else, tumble dryers are quite heavy on the energy, aren't they? So, yeah.
I've sort of gone back to the question, just where else do you think infection control would be in a laundry? I think you're certainly saying A to Z, which I think is great. Any other areas where you think infection control would be a key within the laundry environment? If somebody's waving at us, does that mean...
That means we've got 5 minutes.
Oh, right. It's just popular. Yep.
Hi, good afternoon. I was just thinking, we are talking about laundry and we're talking about all the linen and residence clothes, but most of us, or most of people that wear uniforms, they take their uniform homes, and I think that probably there's no standardized or national guideline on uniforms, and you see people using their uniforms inside of care homes and hospitals, and then they walk out with the same uniform and they go into public transports with the same uniform. In terms of what is infection control, and we see it daily.
I mean, there is guidance. If you take HTM 104, it does say where possible you should outsource to a commercial laundry. That's mainly for nurses' uniforms, or alternatively it should be washed on a 60-degree wash within a domestic environment. The problem is the research Kate has done, actually most people don't wash at 60 within a controlled environment.
Absolutely. No, I completely agree with you. And I think the other thing that's... you're going to get me on a subject here. We've only got 5 minutes. I could talk to you for a few hours about this. The other issue you've got is a lot of the healthcare workers don't realise they can claim tax back and how to do that. Because everyone who's wearing a uniform and domestically washes at home should be claiming tax back, and actually it's quite simple. We've put a how-to guide together, so if there's anyone in the room that wants it and wants to share it with their members of staff, I'm more than happy to share that. But absolutely, the onus has been put back on the healthcare workers rather than it being washed in-house. There's variations in the washing machine, there's variations in behaviour, there's cost, there's the fact that some people have got children, they're carers, they're looking after other people, they can't do individual washing, the fact that shifts are coming too quickly together to be able to launder in between because they haven't got enough uniforms. And although the 60 degrees absolutely does get rid of the microorganisms, it's whether or not that's actually being utilised. And there's so many factors that prevent barriers to that happening, and one main thing is changing facilities as well. So anyone that's interested in that, I'm more than happy to share the research papers with you.
I think current energy costs, I don't know what the cost is.
If you're a care home that stands on its own, I mean, we're a part of a group, we're a bit more fortunate, but if you're a single care home, you cannot outsource your laundry. You are not going to be able to wash everything at 60 degrees or above. It's just not going to happen. No. Sadly.
Why? I know it's...
Pandemic, we were like, I think everybody jumped on board, which was great, in terms of members. We have literally members of the public sewing pump bags for us, for the nurses and for the carers, so that we could put our uniforms in our pump bag that they'd all made for us. I mean, it was so sweet. All the WI got together, made us all pump bags, so that we could, our practices kind of changed during the pandemic. But, you know, now, I mean, with utility bills going up, and also environment, you know, we have got to think about the environment.
Yeah.
We're all being told, turn everything down. Yet, you know, there must be a way that I'm not a scientist, that you can kill these bugs without it. Why can't you kill a bug at 30 degrees?
You can if you start combining with temperature and other technologies, but at the moment it's the validation process. But hopefully this test method we've brought out will empower people to be able to use those other technologies.
We used to outsource our laundry. When I first started, we used to outsource it, and it was like brilliant.
Why don't people outsource?
It's too expensive. It's too expensive.
Is it just cost?
Yeah.
So the logistics of outsourcing.
It's interesting.
And lost laundry as well. Losing residents' laundry, because that's our biggest complaint.
Because certainly the European model is the outsourcing. So you know, it can work and does work. And you know, there are outsourcing opportunities in the UK, and I'm just interested why people haven't tried them.
I think we've got two more questions.
shall we-
So this
I
lady
know,
here
we're
and
being
that.
waved
Should we
at.
start with this lady at the back first, because she's got the mic, so yeah.
So my name's Katie, I'm from a private care home, so just in response to a lady at the front, so we're a single care home, we're not part of a group, and I think it is possible to do things safely and to be able to do them in a proper way, but it all starts with what the ethos of your home and what the values are. For us, we only started it during the pandemic, really right at the beginning, so now we wash all of our staff uniforms in-house, so they don't take their uniforms home. So it wouldn't matter if there was a multiple amount of shifts, they would still have the right amount of uniforms and things like that. But not everyone can do that. And I think although group homes, I think great because you've got big systems that you can use in lots of different homes and it's already there. In our setting, we can tailor it to our own home. And so what works for us, so we can maybe be a bit more individual about it as well. And in response to why we don't outsource, then that's a really good question that you should take to local authorities and say why they pay so poorly for the care that we can't afford to do things like that.
Okay.
Last question. That's a great point.
I've just got 2 points. So one, obviously, I think that's brilliant that they wash the staff's uniform, because I work for the NHS and the NHS has practically got rid of all of their laundry facilities other than theatres. So NHS staff have to wash all their uniforms, so, we're expecting small care homes to outsource, and yet we're sending, a huge company that all their staff have got to do it. And also, obviously, looking at ironing, because obviously ironing is a heat source, and that's your final stage, and the heat there is, so you're mitigating the risks through different stages. You might not have, the top temperature, but you can mitigate that risk by doing other processes.
No, thank you. So, well, thank you everyone for a really good discussion. It's been very insightful. And I think I've picked up on a few points, definitely, that we need to move forward. But at the beginning, we handed out the flyers with the surveys on. So I would, if you all don't mind, ask you to just QR code the things, and just fill in the survey, and it takes 5 minutes. But we really want to understand what good practice is out there, what the barriers are, and just have a greater understanding so that we can help move forward.